Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Every day we will try to discuss at least 40 to 50 PYQs, and every PYQ should make you to know and learn that there are about 10 other points what are there in the examiner's question bank that you need to master. So with that spirit, let us make the great beginning, Doctor. I hope everyone, the voice is loud and clear for all of you. Yes. Now, let's take up the INI CET questions. What is this highlighted structure that you are seeing here? This is the occipital bone to which this structure will be attaching. It is the superior articular facet. It is the question in the INI CET May 2025. Atlanto-occipital joint is a condyloid synovial joint. Whenever we say nodding, yes, it is the atlanto-occipital joint will make us to say yes. So the first cervical vertebrae is the atlas. Atlas articulates with the occipital bone. Dens is the key feature, the dens, which is also called odontoid process for the second cervical vertebra. And the type of the joint, which is atlantoaxial. So many times this came as a PYQ. It is a pivot joint. Then what is the ligament which is holding the dens against the atlas, doctor? It is the transverse ligament. And the vertebral artery passes to the transverse foramina. And normally we have a lordotic curvature, and the most mobile part of our cervical vertebrae is C5 to C6 is what you need to remember. There are the 10 things you need to know about one INI CET question. Now, the various foramina which are there in the calvarium, what passes through these foramina is the favorite question of the examiner. Can the online students can punch whether the voice is loud and clear for all of you, doctor? Nice to see around 10 of you for the Aapke Farmaayish program, right? Can you please tell, are the slides visible? Are you comfortable? I'm going to make you the champion. 6,000 PYQs in NEETPG. 5,000 PYQs INI CET. 5,000 PYQs in FMG. Last 10 to 12 years. That is more than enough for you to become the expert. But every PYQ you need to do an autopsy. What is asked? What can be asked? You need to be doubly sure about it, doctor. right? Can you please punch, are the letters, everything visible? So we created around 20 PDFs for each subject, one PDF containing hand scripted, infographic, illustrated infographs, and created the PDFs. And these PDFs contain all that is needed for you to do the revision about based on that particular PYQ. All right. So the foramina, what nerves pass through that foramina is the question. So the nerve supplying the muscles of mastication is the mandibular nerve. Mandibular nerve is the division of the trigeminal nerve, and it exits through the foramen ovale in the middle cranial fossa. So the oval foramen was the answer. So what are the quick 10 points that you need to master in relation to this PYQ in INICET 2025 May? Trigeminal has 3 divisions: ophthalmic, maxillary, and mandibular. Ophthalmic passes through superior orbital fissure. Maxillary passes through foramen rotundum, mandibular passes through oval foramen. Trigeminal is a mixed nerve. It has both sensory and motor. And what are all the mastication muscles supplied by the mandibular division of the fifth cranial nerve, Dr. Masseter, temporalis, medial pterygoid, lateral pterygoid, they're all by the mandibular division. Then what are the areas whose sensory supply is because of this mandibular division? The lower lip, the lower teeth, the anterior 2/3 of the trunk's general sensation, the skin of the chin, they're all by the mandibular division of the fifth cranial nerve. One of the important branch of the fifth cranial nerve is the lingual nerve, which carries the taste fibers. So it is the chorda tympani of the facial nerve through the lingual nerve will be basically carrying the taste, is what you need to remember. Whereas the trigeminal ganglion, it is located in the Meckel's cave, you need to remember. And what is the lesion? Whenever the mandibular division get affected, the jaw become deviated. Which side? It get deviated towards the side of the lesion. Don't forget, jaw deviation is towards the side of the lesion. Favorite PYQ in the NEETPG exam. Also, the ophthalmic division of the trigeminal, it is the afferent limb of the corneal reflex. Ophthalmic division. Don't forget. Efferent limb is facial nerve. Afferent limb is ophthalmic division. Then what are the trigeminal nuclei that you need to remember, doctor? There is a mesencephalic nucleus for proprioception. Similarly, there is one main sensory nucleus. There is one spinal nucleus for the pain and temperature. So half of the sensation on our face is through the trigeminal, is what you need to remember. One of the favorite questions of the examiner. And it is the same side where the trigeminal nucleus is, the ipsilateral. Unlike your anterolateral spinothalamic tract, which brings the pain sensation, that is contralateral. That is, if my right side got affected, my left pain and temperature gone. But in the trigeminal, pain and touch of the face of the ipsilateral side is trigeminal. That's what you need to remember. So that is how, with one infographic, you will be able to completely get ready based on this PYQ in INICET May 2025. Like that, 6,000 PYQs of NEETPG, 5,000 PYQs past 12 years of INICT and another 6,000 PYQs of the FMG. But you are ready with the exam. So there are 20 PDFs in which we have placed this infographic way of doing the revision, because all our memory, anatomy, medicine, anything is like an image doctor. So this is a completely illustrated review, right? Like the Netter's images, you can remember. In the given image, once more INICT May 2025. What are the structures you need to recognize? Examiner is asking you to do a dissection. There is a superior cerebellar peduncle. This is superior cerebellar peduncle. There is a fasciculus cuneatus, this one. Then there is a middle cerebellar peduncle and there is a inferior colliculus. That is how you need to identify the various structures in the dorsal view of the brainstem. Now let us know what are the 10 points in an illustrated review of the 5,000 NEETPG patterns of Dr. Murali Bharadwaj PDF that you are going to learn. You should know what are the layers of superior colliculus. There are 4 layers. Always remember, superior colliculus in Telugu, sustadi. Sustadi means it will see. Inferior colliculus, intadi. Intadi means auditory in Telugu. Superior colliculus, sustadi. Inferior colliculus, intadi. That means superior colliculus sees, inferior colliculus listens, right? So please try to remember that. Inferior colliculus typically is associated with medial geniculate body. It is the auditory relay center. Superior cerebellar peduncle, inferior, middle. See, brainstem has 3 parts. You have a midbrain, pons, medulla. All the 3 are connected to the cerebellum. Superior cerebellar peduncle is connected to the cerebellum through, it connects the midbrain. Inferior cerebellar peduncle connects the medulla with the cerebellum. Middle cerebellar peduncle connects midbrain, pons with the cerebellum. So superior cerebellar peduncle typically connects the dentate nucleus in the cerebellum, goes to the midbrain and the surrounding red nucleus, and from there it will go to the thalamus and from thalamus to cortex. It's called dentato-rubro thalamo-cortical pathway. Dentato-rubro thalamo-cortical pathway is superior cerebellar peduncle. Then pontine nuclei, midbrain के नीचे क्या है? Pons. Pontine nuclei, it is the middle cerebellar peduncle. And from the medulla and the spinal cord to the cerebellum, you have inferior cerebellar peduncle, is what you need to remember. Fasciculus cuneatus and gracilis, the fine touch vibration, proprioception coming from the upper limb is cuneatus. Fine touch, vibration, proprioception coming from lower limb is gracile. How will you remember? Lower limb किसके ऊपर खड़े होता है? Ground. So gracile is lower limb, cuneatus is upper limb. Now, if you look at these dorsal columns, ultimately comes and lands in nucleus cuneatus and nucleus gracilis. So where is this located? This is located in the dorsal aspect of, not front, back of the medulla. Then you have a lemniscus, medial lemniscus. अच्छा भैया, ट्रैक्ट क्या होता है, लेमनिस्कस क्या होता है, आपको समझना चाहिए. लेमनिस्कस होता है सेकंड ऑर्डर न्यूरॉन्स. Anything that carries second order neurons is called lemniscus. Don't forget. बराबर? So You have two lemnisci, one medial lemnisci, lateral lemnisci आएगा ऑडिटरी पाथ पे, उसके बारे में बाद में हम सोचेंगे. अभी हम सोचेंगे मीडियल लेमनिस्कस के बारे में. It is the internal arcuate fibers and dorsal column nuclei. Until there, the first order neurons come. From there, second order neurons will go, and they form the medial lemniscus, is what you need to remember. And there is a decussation in medial lemniscus. Dorsal column, see the straight. I don't love anybody. I mean, first MBBS, second MBBS, third MBBS. Until reaching post-graduation, it did not fall in love with anybody, dorsal column. मगर पीजी में आते ही दिल को इशारा हो गया. So, decussation of the medial lemniscus typically occur at the caudal end of the medulla, is what you need to remember. So, ultimately, what is needed for NEETPG exam, doctor? Mental picture, visualization बहुत essential होता है बच्चों NEETPG के लिए. And the whole purpose of this infographic mind maps, hand sketched by Dr. Murali Bharadwaj, is to bring you that visualization, which is very easy to do the revision if you are having the visualization, doctor. Right? Now, let's go to the next question. Which of the muscle is not typically associated with dysphagia? Was the INICET May 2025 wala question. Tensor veli palatini is not associated with dysphagia or dysarthria. What are the 10 points you should know? By जब हम swallowing करेंगे, whenever we do swallowing, so please WhatsApp 900868 our helpline number to get the PDF. नीचे भी नंबर जा रहे ना, नंबर देख रहे ना आप नीचे, वो नंबर को आप WhatsApp करो. और you can also join in our WhatsApp study group, right? You'll get the PDF. Swallowing, there are three phases. One is voluntary, involuntary, which is pharyngeal. Third is esophageal. Cranial nerve 5, trigeminal, is the nerve of mastication. Cranial nerve 7 need to do the lip sealing using buccinator, which is cranial nerve 7. Then pharyngeal sensation, which is required for swallowing, cranial nerve 9. And the pharynx and larynx motor supply, cranial nerve 10. And the propulsion by the tongue is done by the hypoglossal, which is cranial nerve 12, is what you need to remember. So, what muscles are important? अगर उसको कुछ गड़बड़ हो गया तो आपको डिस्फेजिया होगा, डिजार्थ्रिया होगा. Tongue muscles, cranial nerve 12. Pharyngeal constrictors, cranial nerve 10. Stylopharyngeus is cranial nerve 9, and palatopharyngeus is cranial nerve 10, is what we need to remember. Don't forget favorite question of the exam. अच्छा भैया, टेंसर वेलाई पेलाटिनी का फंक्शन क्या होता है? फंक्शन होता है, it opens the eustachian tube. It is not involved in swallowing. It is not involved in the speech. Tensor veli palatini. So it is a muscle of the soft palate. So soft palate का 4 muscles होता है. Tensor veli palatini, supplied by mandibular division of the 5th cranial nerve. Levator veli palatini, which elevates the palate, but cranial nerve 10. Palatopharyngeus, which is supplied by cranial nerve 10. It narrows the pharyngeal isthmus. Musculae, uvulae, they shorten the uvula. Soft palate muscles, अच्छा remember करके दिल में लगा के एग्जाम को जाना. Very, very important. Now, doctor, pharyngeal constrictors. Superior, medial, inferior. They are very important muscles for the pharyngeal propulsion. Then भैया स्टाइलोफेरिंजियल का स्टाइल क्या होता है, पैलेटोफेरिंजियस क्या करता है? They are the two things examiner is interested. Stylopharyngeal is by cranial nerve 9, palatopharyngeal is by cranial nerve 10. Oh my God, you need to remember very specifically. Stylopharyngeal supplied by the glossopharyngeal nerve. It elevates the pharynx when you are swallowing anything. Glossopharyngeal ko kuch ho gaya to elevation of the pharynx during swallowing get affected and dysphagia will come. Palatopharyngeus, it also elevates and retracts the pharynx. It narrows the pharyngeal isthmus, and it is important for the gag reflex and swallowing. That's the reason those patients who got a stroke, whose brainstem got affected, whose medulla got affected, unka cranial nerve 10, cranial nerve 12 में दिक्कत होगा, and that lead to dysphagia, which is the feature of bulbar palsy, myasthenia gravis, head and neck cancer, Junker's diverticulum. In all these scenarios, you get the dysphagia. Then dysarthria, coordination. You require coordination to speak and also coordination to swallow. Any bulbar palsy, Parkinsonism, cerebellar disorders, hypoglossal palsy, element facial palsy, anything can lead to the development of the dysarthria. If there is a lower motor neuron facial palsy, the sealing of the lips doesn't occur because buccinator got affected, and that can lead to the development of dysarthria. SPP help you swallow, TVP helps you to equalize. SPP is stylopharyngeus, palatopharyngeus, pharyngeal constrictors. TVP is tensor veli palatini, which maintains the eustachian tube patency. Tensor veli palatini opens the eustachian tube is what you need to remember. This is how one MCQ of NEETPG should open the Pandora's box. You should know what examiner's question bank is there. You need to master that, is very, very important. Now, doctor, the next question of NEETPG. A muscle of mastication which is involved in opening of the mouth exhibits one of the characteristic feature. What is that? It receives innervation of the mandibular nerve. It is attached closely to the temporomandibular joint. It aids in the protrusion of the mandible. So what is the muscle we are talking about? For the opening of the mouth, you require lateral pterygoid, but it is not attached to the medial surface of the mandible ramus, is what you need to remember. So, doctor, the key opener of our mouth is lateral pterygoid. It depresses the mandible. It depresses the mandible. It protrudes the mandible. And it is attached to the neck of the mandible plus temporomandibular joint, capsule and articular disc. So the main function is depress the mandible and protrude the mandible is what you need to remember. So if you look at the lateral pterygoid, typically, where is it attached? It has two heads, upper head, lower head. Upper head hota hai infratemporal surface of the greater wing of the sphenoid, whereas lower head is lateral surface of the neck of the mandible. It is not attached to any medial ramus. That is what examiner in NEET May 2025 is trying to test you. Whereas medial pterygoid का function lateral pterygoid से opposite होता है. Lateral pterygoid depress करेगा, middle pterygoid elevates the mandible, closes the mouth, assists in protrusion, right? So both the muscles are protruders only of the mandible. and it is the one which is attached to the medial surface of the ramus and angle. And the innervation is naruto-medial pterygoid, which is the branch of the fifth cranial nerves. Mandibular division is what you need to remember. So what is temporomandibular joint, doctor? It is a synovial joint, modified hinge joint. Gliding is its function. And typically, it leads to rotation, translation. Rotation is opening, translation is protrusion. Lateral pterygoid by mandibular division of the fifth cranial nerve. Whereas medial pterygoid is naruto-medial pterygoid, which is also the branch of the mandibular division of the fifth cranial nerve. Masseter, temporalis, they're all the fifth cranial nerves. Mandibular division is what you need to remember. Now, maxillary artery. There are two important blood supply to the temporomandibular area. It is the maxillary artery, the deep auricular, posterior superficial temporal, and the facial arteries, masseteric and buccal branches are the ones which supply the temporomandibular joint. So finally, examiner is going to ask you, what are the muscles that open the mouth? The primary depressor of the mandible is lateral pterygoid, and even the suprahyoid muscles, digastric, mylohyoid, geniohyoid, stylohyoid, they all open the mouth. So what will close the mouth? The masseter, the superficial belly of it, medial pterygoid, temporalis, it elevates and retracts the mandible. Most powerful jaw closer of all is masseter. So whenever there is any temporomandibular joint disorder, there will be a clicking sound and pain. So what happens whenever the mandibular division of the fifth cranial nerve got affected? There is a deviation ipsilateral to the side where the lateral pterygoid dysfunction is there, will occur whenever you are opening the mouth. Is a very important principle. So these are few things, doctor. Let it open and push forward. Let it open. L is lateral. So it depresses the mandible, it protrudes the mandible, it is near the TMJ junction, and it is the mandibular division of the fifth cranial nerve is the lateral pterygoid. Favorite questions of the examiner. So what you need to do, doctor, is you need to sit. 3-4 friends baitna hai. You pick up the PDF. There are totally 20 volumes of PDF which are there. Kevi is asking, if we revise all these PDFs by heart, how many revisions are needed and how much time we can get? Beautiful question, Kevi. Please do 9000868 right? So once you do, what you need to do is, these are all the salient features that you need to remember, which are being created like Frank Netter's images. Very good, Kevi. I'm so happy to know that. What you need to do is, 2-3 दोस्तों के साथ बैठो, उनके साथ शेयर करो PDF, नो प्रॉब्लम. बट वो भी पढ़ के आएगा, आप भी पढ़ के आओ. दोनों मिलके, आप सब लोगों ने मिलके क्या करोगे? लेटरल pterygoid का नर्व सप्लाई क्या है? Who opens the mouth? Who closes the mouth? भजन करना पड़ेगा. So every subject there are about 400 hand scripted infographic images. 2 मिनट पकड़ो, 2 मिनट में एक इमेज समझो. Around 25 images you finished in 1 hour. Hardly about 10 to 12 hours for first revision. And after that you need to only do 5 to 6 hours. Every subject का revision हो जाएगा. But you are the topper, right? But what you require, you don't remember, you don't learn if you are passively watching a video. For that matter, whether online class, face-to-face class, anything, we are all non-interactive. We don't know what's happening in your mind, right? Best way is catch 2-3 friends. सबके साथ एक group form करो by 20 infographics. Let us finish. Half an hour may you finish. You ask questions to each other and then feel that you are confident. You don't need any other handwritten notes. You don't need any other material at all, I'm telling you. You don't need any special video to watch. All that memory is very short-term memory. What you listen is short-term, doctor. What you read, what you spaced repeat, and what you actively recall with a group of 3-4 students. I'm already there, your classmate every day. Come say come, even if I'm very busy in hospital, 1 ghanta, I will give my time to you until you get the seat. Right? Yeah, there is a video library. See, the point is auditory, visual, processing in the brain. There are all the various aspects. Don't do only one thing. Whenever you feel some topics are not really catching up, you can listen them, like Liddle syndrome, Bartter syndrome, SADH in the video library. But predominantly what you need to do is a group discussion of these PDFs that will make you to become the winner. Right, doctor? And I'm always there, I'm there in the WhatsApp group, right? And we have our WhatsApp study group. Any listener who is not part of that WhatsApp study group, please let me know. You can call this number, right? WhatsApp the number, and you will get all the help needed. You'll get a direct connection with me. And any doubt you have, any day when your mood is low, count on Dr. Murali Bharadwaj. I'm there to help you. This is the one thing that is most passionate of my life. I am professor of medicine, and past 26 years, I had God-given fortune to inspire 5 lakh medical students who became toppers, and 70% of the Hyderabad top consultants today who are in their mid-40s and mid-30s. They were all my students like you sitting in the classroom. Right, Doc? So now, in this image, the structure which is not associated with the area marked by the arrow. So tendon of obturator externus is not associated. This was the NEETPG, INICET May 2025 question. So basically, what are the 10 points you need to know, doctor? What is obturator canal? What are the contents? Obturator artery, obturator nerve, obturator vein, very easy to remember. Achha bhaiya, obturator externus, how does it pass? It passes to the greater sciatic foramen. Whereas obturator internus, that is where examiner will try to pull your leg. Obturator internus will exit through lesser sciatic foramen is what you need to remember. Now let us talk about pudendal nerve. All the obstetric anesthesia is around the pudendal nerve. S2, S3, S4, pudendal nerve. It exits the pelvis through greater sciatic foramen. It hooks around the ischial spine and it re-enters through the lesser sciatic foramen. And it runs in the pudendal canal of Alcock is what you need to remember. Most of the perineal muscles, pudendal nerve is the god. Pudendal nerve ko kya branches hota hai bhaiya? Inferior rectal, perineal, dorsal nerve of penis, dorsal nerve of clitoris, deep perineal nerve, and superficial perineal nerve. So all the external genitalia sensation that make you to enjoy the erotic life comes from the dorsal nerve of penis and clitoris, which is the branch of the pudendal nerve, is what you need to remember. Coming to the internal pudendal vessels, they all arise from the internal iliac vessels. They exit through greater sciatic foramen. They re-enter through lesser sciatic foramen, is what you need to remember. So there is like a sciatic foramen are like a entry and exit gates. That's what you should know. Ischio-coccygeus. It's a part of the levator ani. The origin is from ischial spine. It elevates the pelvic floor, is what you need to basically remember. Right? So, if you look at the ischio-coccygeus, it is not innervated by the pudendal nerve. It is the S4 via Naru to levator ani is the one which is supplying the ischio-coccygeus. Coming to Alcox. Alcox canal is formed by the obturator internus fascia. It contains pudendal nerve, interpudendal vessels, is what you need to remember. Then, the main landmarks you need to know are where is the obturator canal, where is the ischial spine, where is the lesser sciatic foramen, where is the greater sciatic foramen in the tomorrow's exam. So, if you look at the pudendal nerve, during the childbirth, there is a chance of pudendal nerve injury, and remember S2, S3, S4. It leads to the loss of perineal sensation, urinary fecal incontinence, sexual dysfunction. And how do you test it? Perineal sensation, anal wink reflex is what you need to remember. So, doctor, obturator nerve, pudendal nerve, internal pudendal vessels, perineum and innervation. Open VPI is a very popular way to remember. So that is all the story, doctor. Examiners के question bank में greater sciatic foramen, lesser sciatic foramen, Alcox canal, internal pudendal vessels, perineal muscles. What is their innervation? What is the pudendal nerve? You know what examiner is going to ask you in the tomorrow's exam. Now coming to INICET May 2025 question. Branchial arch derivatives. Oh my God, this is one of the oldest. Every NEETPG, every FMG, every INICET you go, there is definitely a question. So you should know the branches. First, aortic arch, maxillary artery. Second, aortic arch, hyoid and stapedial arteries. Third, aortic arch is common carotid artery. Fourth, aortic arch is right subclavian artery. Sixth, aortic arch is the arch of aorta. So you should know all the arches, doctor. First aortic arch forms maxillary artery, stapedial artery, second arch, common carotid, third arch, right subclavian, fourth arch, ductus arteriosus form from the left sixth arch. Which arch disappears? Fifth arch disappears. Once more, don't forget maxillary first, hyoid stapedial second, carotid third, fourth right subclavian, sixth pulmonary and ductus arteriosus. And the common exam trap, the left fourth arch is arch of aorta, not left subclavian artery. Whereas the right fourth arch is the right subclavian artery. Either examiner aapko pakdega, and you need to basically remember, doctor. So now, what is this histological image which is not an endocrine structure? Right? So not the D. So you should remember what are the various endocrine structures, what are their histology. Pituitary gland, it has an anteropituitary adenohypophysis and posterior pituitary, which is neurohypophysis. The cells are arranged in the cords and clusters. It has a rich sinusoidal capillaries, and its main feature is cords and sinusoids. Ideal cortex, here also cells are in the form of cords, lipid-rich cells called spongiocytes. They're also endocrine, especially zona fasciculata has lipid very rich. Thyroid has a follicular structure, colloid in the lumen, and colloid has thyroglobulin. Parathyroid has chief cells in the cords and clusters, scaly cytoplasm. Chief cells produce the PTH. Pancreatic islets are pale staining islets. Cells are also in cords. Pineal gland has pinealocytes and corpora erinacea, classical feature. Thymus is not endocrine, it has got lobules with cords and medulla. Results corpuscles in the medulla, and it is not endocrine. That's what you need to basically appreciate. So pituitary, islets, thyroid, adrenal, parathyroid, they all have cord-like structure and they are endocrine is what you need to remember. Now, doctor, next INICET question. What is that structure which is being marked here? It is the lateral ventricle. It has a body, it has an inferior horn, and it forms the third ventricle. The structure marked is a fornix. This is what? Fornix. It is C-shaped white matter tract. It forms the medial wall of the body of the lateral ventricle. अगर आप lateral ventricle को देखें तो doctor, there's one anterior horn, body, posterior horn, inferior horn. There are various points. And it communicates the lateral ventricles. There is an interventricular foramen of Monroe, which connects the lateral ventricles with the third ventricle, is what you need to remember. Typically, the midline slit between the two thalami is the location where you have the third ventricle. So don't forget about fornix. Fornix from the medial wall of the body of the lateral ventricle. It separates the lateral ventricular from the other lateral ventricle, or from the third ventricle. From the third ventricle. Then fourth ventricle is between pons and medulla anteriorly and cerebellum posteriorly, is what you need to remember. Cisterna magna, it has a lot of CSF inside it. It is a part of the subarachnoid space. It is posterior to cerebellum. So what is the path of the flow of the CSF, doctor? Lateral ventricle to third ventricle to cerebral aqueduct to fourth ventricle, foramen of Magendie and Luschka is what you need to basically remember. And then finally it will go into subarachnoid space. So what is the aqueduct of Sylvius? It connects the third and fourth ventricle and it runs through the midbrain. So any obstruction in this path, lateral ventricle to third ventricle to cerebral aqueduct to fourth ventricle to foramina till the subarachnoid space, can lead to hydrocephalus. The most common site is, it is the aqueduct fibrosis. Aqueduct of Sylvius fibrosis most commonly lead to the obstruction and the development of the hydrocephalus is what you need to basically remember. So fornix is the wall, Monroe is the door, aqueduct is the pipe, Magendie and Luschka is the exit gate. You need to be 100% sure about it. So this is how doctor pictorially hand scripted pictures like a teacher teaches on the whiteboard. You try to learn pictorially, your mind will remember very easily. So 5,000 NEETPG patterns if you happen to master, You're my man. You're going to be the winner in the tomorrow's NEETPG exam. So, doctor, thank you for patient listening. रोज मिलेंगे, रोज पढ़ेंगे और एक दिन कामयाब होके दुनिया को बताएंगे भाई मेरा नंबर आ गया. So whenever I get time, extempore, I would say suddenly at 11 o'clock or 12 o'clock or early morning 6 o'clock or 5 o'clock, whenever I get time, I'll drop a message in the WhatsApp, join, and we will have PYQ breakfast, PYQ lunch, PYQ dinner. We breathe PYQs, we eat PYQs, we drink PYQs, and ultimately become the topper in the NEETPG. Thank you. And see you all many more times of the day. Thank you.